I think of the people that call in, and a lot of times they would say, I can't believe that you guys do all of this technically under one roof, right? I was like, well, we have our, mental health building and our detox residential, but yeah, we do it all in as one place, right? We can detox you from alcohol, opiates, what have you, and then go treat your bipolar disorder, schizoaffective disorder, whatever it may be, right? And that to me is amazing because I'm going to be honest, that didn't exist, and you probably know, but that didn't exist 10 years ago.
Dealing with addiction or mental health can be very scary and difficult, but dealing with both at the same time can double the complexities and bring more complications on what to do next. On this next episode, you're going to hear from somebody who was a true dual diagnosis patient before finding his recovery process and becoming the director of admissions of a treatment center. Hello, everybody, and welcome back to this month's episode of Finding Mental Wellness. I'm your host, Taylor Brown. Today, we have the pleasure of speaking with Christian Sia. He is the admissions director for Midwest Recovery Centers, both the substance use disorder program and the mental health, and also the outpatient, I should say, and also somebody that's in long-term recovery. So he is going to be able to not only answer questions that you or maybe your loved ones or your families have perhaps wondered at some point in time, but we're also going to get into Christian's story, his reason why he works in this field, and probably a big part of the reason of what motivates him to get up and deal with all that comes at him for all the people that are looking for help. Christian, I know that you're really busy. We work together a lot. So thanks a lot for taking the time to come on and talk with us.
Absolutely. I'm happy to be here.
All right. So Christian, if you wouldn't mind, let's just start with getting a little bit of background on your life and your story, if you don't mind.
Absolutely. Thank you. My story of recovery has been quite a while in the making. I will say that both at the age of 18, I went to, the psych ward for the first time, and I went to my first AA meeting as well. Um, and that was something that was kind of pivotal in my life because that was the beginning of seeking treatments for both of those conditions.
That sounds like a lot to face in one moment.
It definitely was. To be honest, I didn't know what was going on. I was drinking in excess, but I was also experiencing a manic episode and symptoms of depression as well. Um, and I, knew I needed help. But what I did was, at the request of my parents, actually, I went to my first AA meeting. But at a certain point, the symptoms of what I now know to be bipolar disorder were coming about, and um, I knew something was wrong for sure. So I went to actually urgent care, and I mention that because it's not something that most people would do in like a psychiatric crisis or a
Right.
mental health crisis. But I knew I needed to go somewhere, and that's where I felt safest. So I went to my primary care's urgent care on a Friday and described my symptoms, and they immediately got on the phone with a psychiatrist. And it was later that month that I was diagnosed and treated for bipolar disorder.
Wow. Wow. Well, that's certainly grateful and thankful to them for taking the right steps to get you in line with somebody who knew what to do next.
Yeah, no, absolutely. And the exposure to a 12-step program was also extremely beneficial. I will say, admittedly, I was too young and naive to know what was being presented to me, so I couldn't digest it fully. Um, but it made it so that it was weaved into my life. I knew it was an option, right? When I was ready to consider a life in recovery, I knew that would be the first step to go back to a meeting. So that was a
I
peaceful.
wanted to ask you what inspired your parents to want to use or to tell you to go to an AA meeting or a 12-step meeting? Like, did they have any familiarity with that? How did they have that knowledge?
It's funny. I've never actually asked. As a parent of immigrants, they have had to assimilate into American culture. And I think that it's a pretty standard thing. If you have a drinking problem, you should probably go to Alcoholics Anonymous, right? Um, but at the age of 18, when I was having these problems, both with mental health and alcohol, they started to do their research, right? They were saying, is there somewhere we need to send him for long-term treatment? Is there a medicine he should be taking? Is there a certain therapist he should be seeing? Um, but the common denominator in my issues was alcohol, right? That was a way for me to alleviate the strain on my mind, whether it be symptoms of depression or mania. So, when my mom saw that as the common denominator, she said, "You know what? It may be beneficial for you to check out a 12-step meeting." Um,
Wow.
yeah.
That was really insightful of her, to know well, first of all, for you to understand that something was happening in your mind that may not have been totally normal for everyone, and then also for her to be able to see at the same time that you were kind of self-medicating in a way. Because I know there's a lot of people that do that, but then they probably just kind of move forward with the mental health piece, right? And maybe they don't think about whether or not that self-soothing they were doing had developed into like an actual use disorder or whatever it may be, right? So, do, do you think that a lot of your early on drinking was it because you were treating that mood disorder, would you say, or do you think it was also mixed with like just it was fun and it was enjoyable to you?
It was certainly both. I mean, there were periods of time where, drinking and being out with friends was the social norm. So, and the two were always together through high school and in college. That's what you did. You went to parties and you drank and you had a good time. Uh, but where the difference was in my life, pretty early on as well, like when I was like 16, um, up until when in my early 20s. I wouldn't have just 1 or 2 or, like, sip on a drink casually at a party, um, and I noticed that when I was having, pretty severe symptoms, whether it be, associated with, like, depression, fatigue, loss of interest in basically anything that I used to enjoy, I would tend to drink more on top of already drinking more than your average usual individual,
Right.
at that point.
Okay, so it was kinda, like, doubly of impacting you and making things a little bit worse. They were kinda feeding off each other in a way.
And yeah, absolutely was.
Interesting. Okay, so, well, pardon the interruption. Go back into I think you were talking about you had just gone to your first meeting.
Yeah, no, I went to my first meeting and you know what? I think at that point in time, I had made the decision that I am going to continue seeking treatment for bipolar disorder. And there was no intention, no part of me that wanted to stop drinking. I thought if I take care of this condition naturally, the way I use alcohol, my alcohol use would become normal, right? Like, that was my thought pattern. So I went to, work with a psychiatrist, I went to therapy. Um, I was exposed to it pretty quickly because there needed to be some sort of serious intervention that took place, so that my symptoms and my life wouldn't become kind of derailed by this. 'Cause if I'm being honest, I was doing things that were not me, right? Like, I was stealing from my parents, I was not sleeping, I was, being impulsive, but I was also being irrational and irritable to the point that it was concerning because it wasn't consistent with who I was, and my parents saw that.
Gotcha. Thank you so much for being willing and brave enough to just share this because this is a very personal thing. But, I know that people oftentimes are wondering what are the symptoms of bipolar? Or how can you see something like that coming? Or what does it look like as it's developing and starting to manifest? Because I think it's a kind of, for everybody, it's a different age, but the way that that comes on, right, can be different for everybody. But I would imagine families are oftentimes confused or like wondering like what is it, right? Is this addiction? Are they lying? Or is this is an actual mood disorder where they're doing things that aren't like themselves, but also maybe having that mania where they want to kind of they're feeling very high and they're doing things that aren't totally normal. But if you could explain like your personal feelings of it, and you kind of did summarize it just now, but if you could give a quick checklist to somebody who may be going through that right now,
Mhm.
how would you summarize like just a few quick points of things that you started to recognize that led you to believe that it was something other than just a bad week or something was off?
That's a great question, but it's a really difficult one to answer because the presentation of my bipolar disorder was a little bit complex in terms of, um, the impulsivity was there, the no need for sleep was there, but I also had, like, symptoms of depression in terms of, like, it was debilitating. Like, I couldn't get out of bed, and those 2 were happening, like, at the same time, right? Like, the it's what's called a mixed episode, but the true presentation of, like, mania was later, and that was also very frightening, but, for me, it was those things again that were out of character, like the anger or the frustration, the impulsivity, the stealing, I can reference a specific situation where I thought it was a smart idea that I would steal blank checks from my parents and write them to myself and cash them, right? Not thinking that I would get, in trouble or in any capacity. And I remember when confronted by my parents about that, they were like, "What is this? What are you doing? What's going on?" And I was like, "Well, there's a lot of stuff that I don't know what I'm doing. Like, I don't know that, I have a specific reason. I'm not trying to be a bad son or a bad person, but, uh, some part of me is not able to control both my emotions and my actions." Uh, a lot of times the way I would describe it would be that there's like a stimulus and there's a reaction, and a lot of people can meet in the middle, right? But for me, I automatically just go to the reaction, right? Whether that's something impulsive or something dangerous or drinking in excess to try and alleviate those symptoms.
That's an excellent job of explaining it. That I think that's gonna help a lot of people. That's helping me to understand what that must feel like. And again, sorry for the interjection, but, I think you were going forward with talking about the treatment for bipolar, but weren't necessarily committing to the, AA piece of it.
I definitely wasn't. So I had gone to Missouri, University of Missouri Columbia, for about 3 years, and when I came back, I was, 21 on the cusp of turning 22, and I had gotten a DUI, and at that point, my mom said, "This needs to stop," right? Like, "We need to pursue treatment for alcohol use disorder, alcoholism, whatever name you wanna put on it, because this is, as she saw then, the common denominator," right? Like, there was no question that I had a mental health condition,
Mhm.
but I couldn't deny both to myself and to my family now, that I also had an issue with alcohol, and that needed to get better, and I went to treatment for the first time, and again, was very young and naive, and I was under the impression, I remember telling my friend, "I'm only gonna work a few of the steps, and I'm only gonna stay sober for 3 months." And they were like, "That's not how it works." I know, I know.
I wanted to ask you when you were was so you were confronted. It's I'm laughing because I can relate, and I did all of
Absolutely.
these same things, right? Like the delusion, the denial, the ability for us to be so creative with
Mhm.
the BS we come up with to avoid the truth and like getting better, because it's uncomfortable, right? And it feels like what the heck is going to become of me in my life? Am I ever going to have fun again? Like it was like a death sentence to me when I first accepted. Oh my gosh, I'm going to treatment. You know?
Yes, it was, yeah.
It's scary, especially for you, like, when you were in college, right? What did that feel like when you got confronted by family and had to leave a university? Like, what did that was that a bummer or did it suck? What did that look like?
I had to leave the university for a number of reasons. My academic performance was basically non-existent. I was just going out and like, enjoying myself. And there was a moment of time where I had like a mental health crisis and I did end up in the hospital. So I think that my parents were like of the persuasion that I was not going to, make it out there, even if it's just 2 hours away. So they packed up and they packed me up, to go bring me back to Kansas City. And that was not the first time that they had made the 2-hour trip to Columbia or because I was, experiencing some kind of crisis. They would come in the middle of the night sometimes. They would come first thing in the morning and stay in the weekend to make sure I was okay. They would do whatever it took to, make sure that I was getting what I needed, which I'm forever grateful for both my parents. They're absolutely amazing people.
Awesome.
Yeah.
So, okay, so let's get into you were talking about, going to treatment for the first time. So
Yeah,
let's hear that process.
for sure. You know what? It was done for me. I honestly don't remember, being on the phone with anyone at a certain point in time. I just remember that, oddly enough, like, my admission date was, like, 2 weeks in advance. Like, when I learned that I was going to treatment in 2 weeks, and I was like, "This seems like a more of immediate thing," but, like, I don't know, I guess I'll wait.
Right.
And, I didn't wanna do anything to mess it up. So, I
Right.
went to treatment and I was stone cold sober, and they were like, "What's this guy doing?" Like, most people walk in here and they've had something to drink or they've, used their drug of choice, but I thought, "If we're driving all the way here, I don't want to mess this up," right? Um, and I enjoyed the environment, I enjoyed, again, the exposure, this time a little bit more in depth to the 12 steps and meeting with therapists and talking through things. But again, at the age of 22, my scope of understanding um, just how much it would take to change my life and to continue to maintenance this condition was non-existent. I just it's for me, and everyone's experience is different. I have plenty of friends who've gotten, sober and are in long-term recovery, and they got sober at the age of 19 or 20, but for me, it was, quite the experience, and, I'm glad I made it, but, had I done it a different way, who knows? I went to treatment only one time, but, that's not the
You bring up a good point though, Christian. Like you talk about young adults in their early 20s and like most people, I think the truth is most people at that age are not fully developed cognitively. They're not making the best decisions. There's still a level of, I don't know, call it immaturity or call it impulsiveness, just a natural amount of impulsiveness, right? Or just, wanting to do what feels good and what is fun that like I think young people have. So that's really interesting that you can see that you had certain limitations just simply of your age and probably all the people around you and what you're supposed to be doing, in college. It's like, "Oh, you get really
Absolutely.
drunk in college," right? So, like, is this really a problem? Like, there's a lot of people that that we get phone calls, and it's kinda like,
Yes.
well, even the family, like, "Well, he's in college. Is it just that party stage? Is it just, they're in a fraternity or they're doing this or that?" And fill in the blank, but it's typically like a justification for over drinking and thinking that there's not an issue with that. So that does present a real difficulty or obstacle, I think, for people like you and I, when we're first confronted.
No, 100%, and one of the things you just mentioned, honestly, just, like, kinda brought a smile to my face because one of the things that I get to do now, um as someone as an admissions director is talk to people in those situations, right? I've spoken to family members who don't know that their sons or daughters can withdraw from university and go back. If they do have a mental health condition or if they do need treatment for alcoholism or substance use disorder. I've spoken to people who don't know how to deal with their bipolar disorder. I've spoken to people who've been to treatment, 3 or 4 times, and they're wondering what's gonna be different. So my experience and the experience that I've received from other people, whether that be in the rooms of Alcoholics Anonymous or just the people that I, choose to keep in my life today, it lends itself to do this job, and it makes me happy that, like, I can give that experience up to somebody and be either a comfort or support to them.
Absolutely, and I know firsthand how rewarding that is, right? It's
Absolutely.
it's it's incredibly powerful, and we're gonna expand more on that.
Yeah.
But I wanna go back to so tell me about your experience at that first treatment center. You went in with some fear of not wanting to do it wrong or mess it up. But what was it like, that experience going to treatment for the first time?
I messed it up pretty quickly. So I'm gonna be honest with you, I was on detox protocol for benzodiazepines because that was one of my drugs of choice,
Okay.
and I was listening to the other clients, and they said, "The longer you take Librium, the longer you'll be on detox, and you don't get to do all the fun stuff, and, you're just in your detox bed." So I refused my Librium, right? And then I ended up having a seizure, because
Oh
I
my
was
gosh.
withdrawing from benzodiazepines. So, um it was a rough start, and, I was known as that guy that had the seizure, and,
Yeah.
um, I quickly was like, "Okay, it's very clear that I need to not take these just as suggestions, because to me a suggestion is just like, no, I'll think about it. Like, this is a clinical and medical recommendation that's in my best interest. So after that, I was like, I was going to the groups, I was going to meetings, I was listening to my therapist, I was reading the material, I was sitting there writing in my journal. So I took it seriously after that. But,
Mhm.
honestly, and this happened with my second time in treatment as well, what happened was that as the days were coming closer and closer to my discharge date, my fear of going back home was growing and growing, right? Because I was like, I'm gonna leave this safe space, this spot where I've been able to maintain sobriety,
Mhm.
but how do I continue that out in my life again? So that was always something that plagued me. I didn't know, honestly, if I could maintain it, and my first time in treatment, I was able to stay sober for about 3 months after, spending 30 days at a treatment center, but it wasn't until, 8 years later that I went back to treatment again, so, um, it was a long, sordid history.
Like, some people would turn and be like, "Oh, I'm gonna leave. This place let me have a seizure." They blame it on the place, but you were like, "Wow, I didn't listen to them, right? I should have listened to the detox protocol for benzodiazepines." And so you kinda you changed your course of action, your approach, and you did exactly what they told you, and you allowed that negative consequence to instill a healthy amount of fear that drove you to comply with what they were suggesting.
No, absolutely, and again, like, as I listened and learned more, not only from the clinicians and the medical professionals there, but also to my peers, you know, things were really put into perspective for me, right? My big thing, especially at that age, at 22, I thought life didn't go my way, and I was mad at the world and everyone in it because of that, right? And it took me, a couple times where people would be like, You know what? Like, that's awful. I mean, that sucks, but that's life. Get used to it, right? You got to pick up the pieces and move on, right?" They didn't use those words. They use like expletives and all that stuff, but whatever.
Right.
But, I learned that that is the case, right? And I can either wait for life to happen to me, or I can take charge and, put an effort into living my life, right? So,
Absolutely. It's like that. It's like radical acceptance or taking ownership, right? I
mhm.
remember when I was in treatment and I basically learned that I was really dishonest. I wasn't meaning to be dishonest, but I had no concept of what it meant to be really, really honest about how I felt and what I thought about things. And the more I exposed, the more I realized um, how kind of childish or unhealthy some of my like thought processes were, or how I was living. I was pretty selfish and I didn't understand how life worked. It's something that made me smile when you were talking. My therapist, and keep in mind, this was like, this is within the last few years,
Sure.
and I still go to therapy. It's still a very healthy thing for me, even though I have some time. And my therapist pointed out we were doing a workbook on self esteem.
Mhm.
And I came across a section, she was like, "What are some things that you can identify with?" And it was, like, just different scenarios, and one of them was, um, life is not fair, right? And I remember, like, her kind of helping point out to me that
Mhm.
I felt that at times, right? Like, when things are unjust. And I struggle with that if I feel like there's no justice or things are unfair. And she just kind of was a little tickled by that and kind of giggled at me a little bit. She's like, "Yeah, that seems to bother you." And I was like, "Well, yeah, doesn't that bother anybody?" And she was kind of like, "No, not everybody. Some people more than others." And it just was really interesting to see how there's a really big part of me that's like gets upset that life is not fair, you know? And that's a big lesson in early recovery for any human, any adult, but certainly in early recovery, right? Because the things do happen to us. Sometimes we are victims of a circumstance, but we don't have to stay in that. There are tools available to us to kind of move through that. And it sounds like you used the positive influence of peers at treatment who had similar goals to kind of push through that moment?
Yeah,
So
no, 100%. I wanna say that, one of the most beneficial experiences for me was, and this would be at the point where I was, I'm 28 and leaving my second rehab 6 years later, um, but when I finally put my feet on the ground and realize where I was. And by that, I mean that, like, I am going to be present and work a program and do my best to live my life, but take ownership, right? That was scary to me because I didn't like the way that I felt in early sobriety. I felt like I was out of place, out of touch, and I was never going to enjoy anything again, right? So when I talked to my friends, in the program about that, um, all they needed to say was, "I've been there. I know exactly how you're feeling." And then when I would have more like, dramatic moments and start crying and be like, "I'm sad and I don't know why," or "I'm angry and I don't know why," um, having them talk, about their experience, whether it's directly related in some way or just a different experience, but with similarities, um, that got me through those points in time, right? And that's what will get me through anything, that happens to me right now or like, later in life. If something doesn't go my way or if I feel again that life is not fair, I can remind myself that there's a place to go and things to do to get through those moments.
Absolutely. Like you were saying, like that sense of connection and relatability, knowing someone else has been through it can be so, so comforting. And I think in early recovery, I went a lot off of how I felt, and I felt lonely, or I felt like I have to be the only person in the world that feels this guilty or this ashamed or this like fighting this impossible battle. And I'm like, no one knows how deep this black hole goes, that like of how dark my life has gotten and all the things I've done that I'm not proud of. And I was like, there's no way anybody would like me or want to be around me if they knew all of it. And the more I shared though, like you're saying, with other people, other men in sobriety, the more I realized they all did a lot of the same stuff. And they look at me and go, "Yeah, okay. You're all good. That's okay. I did that too," and then we would talk through it and figure out the pieces of it, but just realizing that I could be accepted by other people and not only accepted when I admitted something pretty rough, that I considered to be like guilt-ridden, but it made us even closer.
Mhm.
Because I showed a vulnerability and I showed trust, and it made them feel loved, and then it gave them an opportunity to tell me that it's okay, you know?
Yeah, no, absolutely. And you bring up something that made me think, and I can't believe I haven't mentioned it just yet. But I am a 32-year-old single gay man here in Kansas City, right? And when you go to a meeting as somebody maybe of color or maybe of a certain sexual orientation or whatever it may be, right? Um, you may already feel underrepresented. You may already feel out of place or like you can't say, um, my husband, my boyfriend, my partner, whatever you wanna say, right? I learned a long time ago that if I was gonna be myself, I wasn't gonna filter it, but what I found was when I did have concerns about that, I was met with overwhelming support, right? Like, um it's hard enough, going to a meeting, raising your hand and saying this is your first meeting or what have you. But there's a lot of things that keep people away from meetings, and I knew that that wasn't going to be one of them for me. But there's always that fear, right? Like that you're going to meet somebody or somebody's not going to understand who you are. Um, but that was never a concern, at least with my friends and the people that I've met in the rooms. It's been an amazing experience, and I've fully been embraced for who I am. So, um, all that to say that, like, now I don't filter myself in that capacity because if I can say, I'm a single gay man in Kansas City at the age of 32, living in a studio apartment. If that helps somebody just feel comfortable, I'm gonna say that, right? Like, I can say that I am diagnosed bipolar and that helps somebody with in an AA meeting. I'm gonna say that as well. Um, and it's just something that came to mind as you were talking. So, I
Yeah, well, and it's a large thing to me because it's a part of you, right? It's a part of who you are, and it's a beautiful part of who you are because you didn't allow something that can be different from what some people understand, to not cause you to be too afraid to still be yourself and still connect and still commit yourself fully to this program. And I think a lot of people, if we're being honest, because we have folks call in a lot, right? We help a lot of individuals and a lot of families, and some of these fears, right, prevent people from reaching out for help. They're afraid that someone Yeah, they're afraid someone will discriminate, or they're afraid they won't mix in, right? With, like you said, people of color. They're like, well, what kind of patients do you have there, right? Or like, what age are they? Am I going to be around a bunch of people that use this or that? Like, there's all kinds of fears, and that's when I get to witness you and the team do such an amazing job at comforting and loving on these people. Like, hey, that's not the point. The point is not how we're different, but to love one another because we're different and use that to lift each other up.
Yeah.
Because there's a million reasons in my life that I've dealt with being different for some reason, although it wasn't the exact same as being the new gay guy that had bipolar that was sober. I've been in a position where I had a few things that made me kind of the odd man out in a sense, and I still had that fear. Like, am I going to belong? Are they going to what if my jokes aren't funny? How am I supposed to stand? How do I hold my hands? Like, everything down to, like, "Oh my gosh, who am I?" And I think everybody gets that. I think the labels make it feel easy to identify, but I think everybody goes through some of that. But thank you again for your openness and sharing that, because that's such a beautiful thing that I want people to hear, that no matter what's going on with you, right, or what's a part of you in your life, it doesn't need to prevent you from asking for help.
100%. Yeah, I couldn't agree more, and that's why I mentioned it. If somebody sees this and they say, "Wow, like, if he can be that open about something, then I can make the call and get the help too." So,
Mhm.
yeah.
And, I'm sure there have been meetings or situations, well, maybe not, I don't know. But I'm sure there have been situations where maybe somebody did say something, distasteful, or maybe somebody has approached you in a way that was not with respect or whatever. And I imagine that, working a program now and understanding that that's more about them than it is about you
Yeah,
is another thing that's helped me, right? Like, I'm not saying I always do it, but what the program's taught me, right, talking to other people, is understanding that people have reasons for acting the way they act, right? And maybe they have a wound, or they've been through something and they were hurt. And so they get in that frame of mind of, like, it's me versus them, right? Rather than just wanting to understand people. So that's, I don't know, that made me think about that's a beautiful piece of working a program, as we say, or going to treatment, getting good therapy, is to seek to understand people.
yeah. And I've never had, like, an experience where somebody, made a distasteful joke or said something that was legitimately offensive, and I thank God for that because I personally would feel that I would not have the right reaction, like, I would be pretty upset and be like, "This is not the place," right?
Right, right, right. Understandably so, right? Understandably so. So, yeah, well, thank you for sharing, like, a bit about your story and what it's been like. Tell me about what it was like as you launched into sobriety and how you ended up here.
That's a amazing story, and I love telling it. I actually was working at, one of the Blue Valley schools, one of the high schools, as a special education paraprofessional. Prior to that, I was, serving and bartending, and I had done that for, like, 8 years. And what I thought, after coming out of treatment at the age of 28, I was like, "I can't continue to serve and bartend, because that's probably not the healthiest environment for me." But I do need to do something that is going to be fulfilling and rewarding for myself. And after talking to a couple people, that recommendation was made. Like, hey, be a para at a high school. Like, you don't have to do it forever, but you'll learn a lot and you'll be in a position to maybe be exposed to other things. And um I was in school actually to studying for early education and early childhood education, but I went and then I had talked to a friend of mine, Riley Birch, and Riley had known that I was kind of looking for my next big move, right? Like, what am I gonna do? And he texted me one day and he said, I think you should consider this job at MRC. I think you should reach out to Taylor Brown. And I was typing, and he could tell already what I was typing, and he answered immediately. He said, "I know exactly what you're gonna say. You're not qualified. You can't do it. There's so
Yeah.
many reasons why. Just call him." And I think later that day, I either called you or I, somehow obtained your email and sent you my resume. So,
Mhm. I
uh,
remember it happened pretty quick.
yeah, no, and I really wanted to take the opportunity, and, when I first came into work at MRC, I was a business development representative. I was doing community outreach, going to talk to other representatives that work at other agencies and talk to case managers and, emergency room nurses. And that was a new experience for me too. But I was also trained in how to do admissions. So if I received a referral, I wasn't, the middleman. I could do the admission, right? And I took to that very well, I would say, because, it became natural for me to talk to people in crisis or talk to people that were wanting to find out information, about our program, right? And that was very much enjoyable, and when the opportunity arose and was presented to me to go into, admissions management, I think I jumped at that just as quick as I emailed you initially when I wanted the job.
Yeah. Yeah, yeah, no, I remember it was, and it happened in a way where somebody was kinda moving on to greener pastures, and it was a little bit of a, like, a quick thing, it's a bit sudden, and so I felt, as I normally do, I'm a little bit type A and neurotic, and I got really nervous, and I remember, reaching out, and I didn't wanna put pressure on you to assume that you would be okay with it, but I remember Kevin, our CEO, saying, "Why don't you ask him, and why don't you let him decide?" And I said, "Duh, of course." And then I reached out and you pretty quickly arose to the occasion and just, here recently became the admissions director over an entire team, and, which is really exciting. I mean, opening up a program in Iowa, and we're expanding here in Kansas City, and you're getting to oversee, I mean, literally hundreds of individuals that are coming through here, hundreds, almost a thousand a year, and not only that, but, like, thousands of families that call in that don't end up coming here, but still get help from the team because you're so diligent on making sure people that don't have insurance to come to us, but maybe it's Medicaid or maybe it's something else, you run such a healthy, tight ship in terms of knowing the resources. I mean, you've helped me on countless occasions with knowing where people who don't have insurance or don't have housing or don't have food or don't have some type of security that they ought to have in life, like where they can go to get that. And that's something that's always stood out to me when it comes to you, Christian, is that you care deeply and you take the time to investigate what those resources could be for people. You know, we couldn't have picked a more perfect person to run this department, and MRC is better because of you. So
I appreciate that, and I do wanna give a shout out to my team, of 4 admissions coordinators that are absolutely amazing, Sydney, Krishan, and Elias. They make it possible for me to do my job because they are rock stars on the phone. They are the people that are connecting and supporting those people that are calling, whether it be themselves or the loved ones that are calling. I just could not do it without them, and of course, Taylor, I consider you a mentor, so just a little shout out to our host, Taylor Brown, as well, so
thank you, thank you. Well, I was gonna ask you a couple quick questions really fast just because we have families asking these all the time, and we don't always get the director of admissions who is a wealth of information, the person that behind the curtain that's helping all the families. So I'm gonna do the quick style ones if that's okay.
yeah, for sure.
I know you have to get back to some stuff. So, okay. What is detox really like for somebody walking in the first time?
That's a great question and one that I get often. Detox for someone that is coming in for the first time. Most of the times, the questions that we receive and that I receive on the firsthand are, am I going to get medicine immediately? How long am I going to be on detox protocol? What do I do during detox protocol? And what I tell those people is that yes, you'll meet with a provider, and there may be some medications prescribed to you during that time, depending on what we find out. But um, it's important to note that, like, we're also there to keep you safe and then comfortable, right? Because that is a difficult period. For anyone who hasn't been through detox before, it's a very scary process, and we try to remove that fear by talking through that. And I referenced the admissions coordinators that work here, having some knowledge of how that works as well because they've been through it themselves at this program, right? Like that has removed so much fear from somebody coming and starting detox. Myself, having been through detox 5 times, it's like I know how to talk to somebody about that, right? And it is a scary process, but removing the fear is our main priority, and we do that by explaining, "Hey, listen, this is what you can expect. You will meet with a provider, a medical provider that is going to do a full examination of you and your symptoms and take care of you. We're going to make sure that you don't have any adverse or severe side effects because of withdrawal, and we're gonna avoid that and do our best to keep you, again, safe and comfortable."
Mm. Oh, that's great. I love it. Okay, let's see here. How do you treat mental health and addiction together? What if I think they're alluding to like what if somebody has both? Kind of like your story,
Yeah,
but
like
what
if
would that
like if
look
I
like
were to
for
come
that?
into Midwest recovery.
Yeah, yeah. What would that look like?
Absolutely, 100%. You know, when you're coming into a program like this and you present with a dual diagnosis issue, the important thing is to safely get you off of that substance that you have been using. So we may start you at our detox residential facility. And then once you are off detox protocol and you've met with the clinicians and your medical provider, the nurse practitioner, we may decide that you would be a better fit to go to our mental health program. And that is done, you know, with the patient in mind. We have their best interest at heart. But you know, a lot of times you may benefit just as much from you know, doing a 30-day residential program and then looking at what that is like to continue your mental health treatment. You know, I often think of what I would do if a facility like this was in operation here in Kansas City when I needed treatment for the first time. And I'm going to be honest with you, like I would probably deal with the alcohol first and then say, I need to get on a healthy medication regimen and I need to get active and get a therapist. So having these available therapies and modalities of care that we offer at our disposal is absolutely amazing. I mean, I think of the people that call in, and a lot of times they would say, "I can't believe that you guys do all of this technically under one roof," right? I was like, "Well, we have our,
Hmm.
you know, mental health building and our detox
Hmm.
residential, but yeah, we
Right.
do it all in one as one place, right? We can detox you from alcohol, opiates, what have you, and then go treat your bipolar disorder, schizoaffective disorder, whatever it may be, right? Uh, and that to me is amazing because I'm going to be honest, that didn't exist, and you probably know, but that didn't exist 10 years ago.
Right.
You couldn't go
Right.
somewhere and get those things, right? I mean, I remember going to Shawnee Mission Advent Health and doing detox from alcohol and benzos, and then I had the option to go to an IOP program, or go back to my therapist, or find something that was on the East and West Coast that cost a lot of money.
A thought I had while you were talking about us treating both addiction and mental health is a lot of individuals may have gotten incorrect diagnoses if they did a psych evaluation while they were withdrawing from a particular substance or alcohol. I mean, you and I know people can have hallucinations and be psychotic when they're going through alcohol withdrawal, as well as stimulants like amphetamines, whether that's Adderall they're abusing, cocaine, methamphetamine can induce psychosis itself. So to get a healthy, true baseline, exactly what you said, like they would want to start at a detox residential facility to be safely taken, rid their bodies rid of those harmful chemicals. And then, once the professionals say, okay, we think they're ready. We think they'll score accurately now. Like now let's shift them over to the mental health facility where we can get an accurate reading into how their brain is really performing and what those chemicals are doing, So it really is a beautiful thing. You're right. I mean, maybe even 5 years ago, that was not a thing.
Yeah.
Literally in the last 3 or 4 years that us and a couple others just started doing it, so thank God for that. But, Christian, I know that you have to get back to the busy day, and I wanna thank you so much for coming on, finding mental wellness, and telling us your story and answering some questions to some people that are wondering how to help their loved ones.
Well, thank you for the opportunity to be here, and I can't wait to see all the other episodes of Finding Mental Wellness.
Absolutely. And as always, everybody listening, if you or a loved one are struggling with mental health or with substance use disorder, you can reach out to our team 24/7 at 816-597-1177. And thank you so much for joining or for listening. And that's going to be it for Finding Mental Wellness. And we'll see you next time.